Patients who have been infected with the coronavirus and have recovered could be the key to fighting the disease. One potential treatment uses the antibodies built up in the blood of patients who've had the illness. Dr. Jon LaPook shows us how testing is already underway.
What we're doing is monitoring these patients very closely.
This past weekend, Dr. Eric Salazar supervised a treatment at Houston Methodist Hospital he hopes will become the first proven therapy against COVID-19. Here's how it works. Blood taken from recovered patients contains antibodies that can attack the virus. Dr. Salazar and his team transfused plasma, the part of blood containing those antibodies, into 2 critically ill patients.
Have you discussed a goal for how many people you'd like to be able to treat a day using this method?
As many as possible.
Dr. Salazar is watching closely to see if the transfusion works. It may have helped in a small number of patients in China, but much more study is needed. Kindergarten teacher Julie Thaler, a COVID-19 survivor, has donated her blood to possibly be used in a similar transfusion in New York City.
I am one of the survivors. It's a tough ride. I got very lucky, and it was a way that I could give back.
A lot of it's going to depend on, the donor pool.
Dr. Nicole Bouvier and her team at New York's Mount Sinai will soon be using the same treatment just performed in Houston.
Why do you think this might work?
We have some idea, partially from the 1918 influenza pandemic, that taking blood plasma from one person and giving it to another actually may improve outcomes.
Antibodies against coronavirus are not only being used for treatment, they also help identify people who may have been infected without knowing it.
An aggressive testing regimen with our front lines to find out, who has levels of immunity is an opportunity to get back to the new normal as quickly as possible.
Lou Reese and Mei Mayhew are co-CEOs of United Biomedical, an international biotech company. They're one of several companies to develop a simple rapid blood test for COVID-19 antibodies to see if someone has been infected and built up immunity to the virus. Their current plan? Test as many of the residents of Colorado's rural San Miguel County as possible.
How many people do you think you'll be testing?
There's just under 8,000 in the county. We'll be able to find out who's been exposed and who has antibodies, and hence who has a certain level of immunity to this.
Once the antibody test is more widely available, researchers will be able to screen large numbers of potential donors for antibody-rich plasma to be used for treatment.
I don't think any center across the country is going to have any trouble recruiting donors that have recovered from COVID-19. These are incredibly generous people.
And Dr. Jon LaPook joins us from home now. John, why is it so important to do widespread antibody testing?
Anthony, it's very likely that there are a lot of people out there who have been infected with the new coronavirus but had little, few, or maybe no symptoms at all. And this is going to help us to get our arms around it. I mean, this is hugely important. Think about it. If it turns out that those people have some immunity, some protection because of these antibodies, now, depending upon how much protection they have, maybe they could go back to the front lines again, and we won't have to make this choice between do we save the economy or do we save the healthcare system. Now, there are a lot of questions here. How protected are people? How long will the immunity last? There are a lot of questions and a lot fewer answers right now.
John, how soon after patients get these plasma treatments will we actually know if it's working?
In China, there was a report of just 5 patients in China who had this done, and they had other therapies, so it's hard to really know. Over the next week or 2, they seem to get better, but again, we don't know if it was the antibody treatment or other medications they were getting. In the past, back in 1918, in the pandemic flu, there was some success, and there were sporadic cases here and there, but there's never been a huge controlled trial to see exactly how this works and in what people it works and for how long it lasts and things like that. So this will be an opportunity to do that, Anthony.
All right, still something promising. Dr. Jon LaPook, thanks, John.